osteoarthritis, degeneration, they're things that we all will get. And this is the example of degeneration in the spine. So the spine facing that way. We look at the alignment of the vertebral bodies. These are the bones in the lower back. Usually there are 5 bones. Some people can have 6. It's a normal congenital variant. It's not linked with any real problems. But this is an example of a side posture view, a lateral view of the lumbar spine, so the lower back. Looking at the curvature here, the lordotic curve we would call this. This is a secondary curve. The first curve we have, primary curve in the fetal position, is the mid-back, and as we develop, we become upright, we develop this low-back lordotic curve. This is slightly straightened, so it's lost part of its lordotic curve. Visualizing it with the eye, obviously I'll go and measure that. We look at the spaces between the joints, they're slightly reduced. And we'd also look for signs of degeneration, so osteoarthritis, as I said when we first started. So these are the vertebral bodies, and in here this represents the disc. The vertebral bodies are the white parts, and these sorts of sharpened edges, claw, osteophytes, they develop with wear and tear. This is on the front of the vertebral body. We have an anterior longitudinal ligament that goes all the way along here, and these can push into there. The anterior longitudinal ligament prevents the bones from pushing forward. There's a posterior longitudinal ligament that goes along the back. If we join the pencil line up, they should all line up. We look to see if the vertebral bodies have slipped. Sometimes, if it looks like it with the naked eye, it can mean that there's something called a Spondylolisthesis. You can have one from birth, or you can have one that would be caused from perhaps a fracture. If someone was to fall, or a mechanism of injury that would cause it to fracture, you'd have a pars interarticularis fracture here, and the vertebral body would be further forward. We'd measure the degree of slippage of spondylolisthesis that there would be. That would obviously then be associated more times than not with some sort of pain. People would come in. And then the other thing that we're going to look at is if there's any soft tissue effect. So this is, one of the standard x-rays that a chiropractor would ask to see in a set of films. We would always use ones at right angles, so we would most likely also have one from the AP, anterior posterior view, and when it comes to that, we would then look at the alignment again to see whether the pelvic structures are level. Sometimes it can be if they're at this angle because of a leg length discrepancy, which is possibly a structural leg length discrepancy, which could be from birth, so one limb could be shorter, or it could be functional, where there could be a psoas muscle, so the muscle that goes from the transverse process area here of the lumbar vertebra 1 or the thoracic vertebra 12 through here and attaches to the top of the femoral area here. And if it's tight, it can cause shortening of the hip on that side. So anyway, so that's if we look at an anterior posterior view in an x-ray, which I haven't got the time to show you at the moment. We would look for, first of all, alignment, the bone, the soft tissue, and other things. And that's my example today of looking at the side view, a very general, very basic side view of the lumbar spine, just the general principle of what we're looking for. When we explain to people in layman's terms, obviously we'll take a lot more time to look at things and iron out if there are any other problems, but I hope that helps people.